Hello, I'm Professor Julia Newton. I'm a consultant working at the Freeman Hospital in Newcastle upon Tyne, where I see patients with liver disease, particularly Primary Biliary Cirrhosis, or PBC as it's commonly known. If you're watching this film, you've probably recently been diagnosed with PBC. The chances are you haven't heard of it before, and you may be feeling worried or even frightened. What I want to do through this film is to provide you with a comprehensive guide to PBC and answer questions that you may have, such as, what exactly is it? How will having it affect my life? And what can be done for PBC? Newcastle is one of the leading places in the world which specialises in liver disease and PBC. The Freeman Hospital sees over 10 new patients a month with PBC. Our patients have access to the latest information, and many are taking part in ongoing research to help us learn more about PBC. Participating in these studies helps patients to understand their disease and also gives them a real sense that they are making a difference in the future of PBC. Many of these patients have been invaluable in telling us what they would like to have known when first diagnosed with PBC. As a result, we hope this film will inform and reassure you. We will listen in on a consultation with Professor David Jones, an expert in the field of PBC. We will hear from a number of patients about their personal experiences and also from some partners of PBC patients. So here we see a patient who has been referred by her GP to see Professor David Jones.
Well, looking at the test that the GP did and sent to us, and having chatted to you, I suspect that this almost certainly is PBC.
How do you know for certain that I've got PBC?
One of the advantages we have is that there is one of the tests that is very helpful in diagnosing PBC, and that's an antibody test which recognises anti-mitochondrial antibody, or AMA, and that's very unique to PBC. Over 95% of people who have that antibody will have PBC. When you combine that with the liver blood test that the doctor did, then that gives us a certainty of close to 100%. Now, one of the things I'll mention from a diagnosis point of view, and I'll mention it really to discount it, is liver biopsy. And I mention it because a lot of people have read about the disease and perhaps gone on the internet. And you'll read about liver biopsy where we take a piece of tissue from the liver to look at under the microscope. A number of years ago, they would always have confirmed the diagnosis of PBC with the biopsy, but we now no longer do that. In fact, it's a recognition of the importance and value of the antibody test. So we only do liver biopsies in a small group of people, probably less than 10%, where there is a particular question that we can't answer, or there is a specific aspect of the disease that we're keen to investigate, and we perhaps touch on those later.
So how did I get liver disease? I mean, I don't drink very much.
This is a real problem, and it's one of, I'm afraid, of ignorance. There is an assumption out there in the broad population that liver disease is always caused by alcohol consumption. There are well over 100 different types of liver disease, only one of which is caused by alcohol.
So what's going to happen to me now?
For most people, the risk of progression of the disease to advanced liver disease is relatively low, but we still look to treat people to reduce that risk even further. Now, the bedrock of treatment relates to the exact nature of how the disease occurs in people, and it's all to do with what the liver actually does. Now, many people think that it's the kidneys that excrete the waste products from the body, but in fact the kidney's role is just to get rid of fluid, and it's the liver that gets rid of toxins you may have taken in the diet or have been produced by the way in which the body works. And the way it operates is that the toxins are taken up out of the bloodstream into the liver cells themselves. Now, the liver consists of millions and millions of identical cells, all of which perform all the functions of the liver. The toxins are taken into the liver cells and they're then tagged. And because there is a tag present, they are then thrown out of the liver cells into a drainage system that gets rid of the toxins into the bile, ultimately into the bile duct. Now, the liver is triangular shaped. It sits underneath the rib cage on the right-hand side. And the bile ducts drain out from the liver out into the bowel. Now, I use an analogy of the River Tyne. So this is the River Tyne draining out into the sea, which is the bowel. There are the ducts to the right and left-hand side of the liver, which is like the North and South Tyne. But within the liver, what you have are a series of smaller and smaller bile ducts that all collect together, rather like the streams in the hill, to use my analogy. And using that analogy to its limit, PBC is a disease of the very small streams in the Pennines where the water first collects together. So PBC is a disease of the very small bile ducts. And those bile ducts are lined by cells which are damaged and eventually killed off. And what you then do is lose bile ducts. That means that you lose the ability to collect bile, and so bile builds up within the liver. And one of the constituents of bile that builds up in the liver, normally in humans, is a type of bile acid which is irritant to the liver. And it's this bile acid that contributes to the damage that occurs in the liver. If you give a tablet form of a non-toxic bile acid, what it does is get into the body's recirculation of bile acid. The body reuses bile acids all the time, and you can get the non-toxic bile acid into that circulation, and it replaces over time the toxic bile acid. And that means that you reduce the buildup of bile in the liver, you reduce the damage, and you reduce the effects that happen to the liver. This is bile acid therapy. The nature of the tablet that we give you, it's called ursodeoxycholic acid, which most people find is a bit of a mouthful and tends to be abbreviated to URSO. That's the mainstay of treatment for patients, and we recommend its use in everybody with PBC. A small group of people have an additional component to the disease process, which is an increased amount of inflammation. So around these bile ducts, the immune system can cause extra damage. Now, that doesn't affect most people, but the group of people it does affect can have a more aggressive form of the disease, which can cause them more rapid damage to the liver. And those people potentially benefit from an additional treatment that addresses that inflammation. And that's principally with steroids, but also with some other drugs. Now, we don't use steroids in the vast majority of PBC patients. It's only a small group of people, but it may be a very important group of people because of the risk of the disease progressing and maybe even some symptoms as we come to later. So in the clinic visits that we will have, we'll be looking for the features that will make us concerned about that aggressive form that may benefit from extra treatment. And first off, that will come with one of the blood tests, which measures the immunoglobulins, the immune factors present in the blood. And there's a particular form of immunoglobulin, IgG, that we'll measure. And if that's elevated, that would make us suspicious. We would always want to be certain that was going on before starting aggressive treatment like steroids, and that's one of the situations in which we would recommend a liver biopsy to understand precisely what's going on. So the secret with biopsy, to follow up what I said before, is to target it to the situations where it gives you additional information that will be able to help address particular treatment opportunities. So URSO for everybody, steroids for a small and targeted group of people. One of the treatment that I do mention, and I mention it largely because people have often read about this, underneath my badge it says liver transplant, and I would be fooling you if I said that liver transplantation wasn't useful in some people with PBC. The important thing is it's not something that is at all relevant for the vast majority of people. A small group of people, maybe less than 5%, will need liver transplantation. But it's important because you'll read about it and you will see it talked about on the internet. The way for somebody with early stage PBC to think about transplant is to think of it as a safety net. It's there should in the future things change, but for the vast majority of people it's not going to be something that is at all relevant. I tend to mention it to stop you being concerned about it.
I tend to suffer with itch. What is there that you can do for that aspect of it?
This is where we start to move towards the symptoms which can affect your quality of life. And probably the most important of those is the itch, which is very characteristic of PBC. It's not the commonest symptom, but it's the one that perhaps has the biggest impact and is also the one that we can do most about. We think the itch is caused by some of the toxins which don't drain into the bile duct, getting out into the circulation, ending up under the skin and irritating the skin. URSA may have some role in controlling itch, and most people with itch would naturally be on URSA anyway. The first line of specific treatment for itch was with a drug called cholestyramine. One of the trade names is Questran, and this is an agent that sits in the bowel and it binds toxins. So it takes toxins out from the circulation, binds them and allows them to be passed out from the body. So cholestyramine is the first treatment we tend to give for itch, and it's very safe. The downside of it is that it has a bitterness to it. It's quite bitter to taste. I've tried it myself. It is fairly unpleasant. So we suggest that people perhaps add fruit juice or something like that to ameliorate it a little bit. So you can't affect the way it works. It will still be effective. We persevere with Questran or cholestyramine because it's an effective treatment if it genuinely isn't going to work for you. And one of the things that we know about itch treatment is that different treatments work in different people. Then there are a number of different tablets that we can use that can help control it. And the vast majority of people, there is something that will be able to help for it. But we would talk about those particular tablets if we found that we weren't getting where we wanted to be with cholestyramine treatment. And if it's okay with you, we'll also start the cholestyramine today. One of the things that's really important about cholestyramine, don't take it with URSA at the same time, because the two will bind together and you'll lose the effectiveness of both. And we tend to suggest to people to take the cholestyramine, Questran, through the course of the day in spaced doses, and then take the URSA as a single dose at night.
Fatigue is another thing that I suffer with. What can be done for that?
Tiredness is another of the major factors that affects the quality of life of PBC patients. And it's the thing we know less about. It's perhaps only been more recently recognised, and it's an area where there is less in the way of treatment, although it is improving. The reason I think why it's been less recognised is the problem that we all get tired. Itch is always abnormal, but tiredness is something that can happen to anybody, and people tend to think of it in terms of being perhaps something which has occurred because they've been working too hard or too much looking after the family. So think that it's part of life, and in fact it isn't. It's something which has come about as part of the disease. In terms of treatment, actually one of the first things we need to do is to get the itch treatment right. And the reason for that is that there is a particular association between itch at night and problems with sleep, which have a knock-on effect in terms of tiredness. So in terms of what we can do about tiredness, the first thing to do is get itch control right, particularly because of the nighttime itch issue. That leads us on to something else that we can do about tiredness, which is address the broader issue of sleep. We think there is a link between, at least in some people, tiredness in PBC and poor sleep. So an important thing to do is to think about any factors that may be interfering with your sleep pattern, perhaps sedative drugs, perhaps alcohol in the evening, certainly caffeine containing drinks, coffee and tea in the evening. So thinking about anything that may get in the way of sleep. Another thing that seems to be associated with the tiredness in PBC is where there are effects of other medications that might be perhaps related to blood pressure, and one of the things that we recommend is that all the treatments that you may be receiving for other reasons are reviewed by either ourselves or your own family doctor to look at whether there are some treatments that may be contributing to this, which maybe could be stopped, which aren't necessary anymore because your health has changed over the years. And the giveaway in terms of that element is whether people get dizzy when they stand up or even perhaps have blackouts. So again, looking at medication is an important part of thinking about how you can control tiredness. There are some other areas that are important. there are certainly aspects of the disease itself that can contribute to tiredness, and in particular the inflammatory form of the disease that we talked about, as well as perhaps being more aggressive, it can certainly cause worse tiredness. And thinking about that and treating about that where it's appropriate is a productive thing to do. The final thing to think about is perhaps other diseases that may be associated with PBC, which are themselves associated with tiredness. Thyroid disease is associated with PBC, it's another immune disease, and it's very common for PBC patients to have thyroid disease, and one of the classical symptoms of thyroid disease is tiredness. So thinking about potential other causes that may be associated with the PBC. In terms of what you can do about the tiredness, I think it's important to think in terms of the ways it affects you. Sleep we've touched on, but some people it can be a very muscular type of tiredness. It's not a central brain effect, it's a peripheral muscle effect, that they have difficulty doing things. The motivation to do things is there, the capacity to do it isn't. An analogy a patient used with me, which I think is a very valuable one, is of power in the context of a torch with its batteries running down. You turn the torch on, it shines brightly, but very rapidly the light fades away as the power drains. You turn the torch off and leave it to rest, turn it on again, the power is there again, but it fades even more quickly. And patients recognise that analogy about their limitations, the amount of power they have. I think it tells us something about what the causes of the tiredness are, but I think it also gives you a clue about how to manage it, which is to pace yourself and to think of the amount of power that you have and to use it in the way that suits you best. So think of the ways in which you can use power, but also save power at the times when you don't need to use it. A lot of people will say they have good days and bad days, and I think that, again, is something you mentioned. That seems to be a feature of the disease, and it's important because it can help you plan your life, so that if it is a bad day, then listen to your body and adapt as best you can. But if it's a good day, take advantage of it. If it is a day that's a bad day and you've got to do lots of things, then don't be frightened of doing things. You won't cause yourself any harm, but you may pay a little bit of a price in terms of the tiredness that you get later on. Finally, and in a related way, exercise probably is helpful. It helps the ability of the body to be able to generate power, and so we recommend sensible exercise, building up from the level that you are able to do it, but listening all the time to your body. So the opportunities when you feel like you have a lot of energy, do as much exercise as you can in a sensible and controlled way, because it probably will help over the longer term. I think the treatment of the tiredness will improve over time, but at the moment it's mainly common sense things related to pacing yourself and how you live your life, related to making sure there are no other additional factors that need to be treated related to the liver disease or to other associated diseases, thinking about sleep and thinking about the way in which your circulation works and making sure that we don't create the problem by perhaps some of the medications that we give you.
So having PBC, I mean, is there anything that I can't do now?
The short answer is actually no for somebody who's likely to have early stage PBC. One of the common questions is about alcohol. We've touched on that. This disease really has no link to alcohol at all. We would recommend anybody with any type of liver disease to exhibit common sense about alcohol intake, perhaps no more than 10 units a week. Perhaps surprisingly, smoking is commoner in PBC patients than in other people. We don't know what the link is, and so obviously anybody who's smoking, general health advice will be that they should abstain from that if at all possible. In terms of diet, one of the things you may notice is a little bit of bloating with fatty foods, and if that's the case, be aware of it and just either reduce the fat content of the diet or space out the way you eat fatty foods. A lot of people ask about exercise. Exercise is probably good because it does help eke out the energy that your muscles have. In a sense, people can be trained like athletes to be able to function better, and so don't be frightened of exercise, but do it fitting in with the rest of your body's ability to cope. People often worry about other medications. A lot of drugs are metabolised by the liver, and there are some concerns about potential drug toxicity. In truth, those things are relatively uncommon in PBC, but common sense says that we should look carefully at all medications you might take, and that includes over-the-counter medications. Be cautious about some medications that you can buy, food supplements, alternative remedies, because they in fact can have issues relating to the liver. So it's general common sense in anybody with a liver disease that you're cautious about all drugs that you take, at least think about whether they're truly necessary, and that's done in conjunction with ourselves and with your GP. But in general terms, there are no particular pitfalls. The advice is that this is a disease you'll have to live with. I wish we had a cure for it, but we don't. We can control and manage it, but it will always be there. And it's important that you continue living your life and not letting the disease rule your life, but just some simple common sense measures will help you have a good quality of life.
I have 2 children, so I've been wondering how me having PBC might affect them in the future.
It's a good question. It's one that's asked very frequently. PBC is not an inherited disease, and that's the important thing to say. There are, however, elements of it that run in families. The disease is one of the immune system, and the building blocks of our immune system we do inherit from our parents. It's rather like our height. You can predict the height you're going to end up from the heights of your parents. And we talk about the immune system, but in fact, different people have immune systems that work in very different ways. Some people have very aggressive immune systems. Some people have very passive immune systems. And aggressive immune systems are the ones that tend to be associated with these types of disease. We call them autoimmune because the immune system turns on yourself. There is nothing wrong with that immune system. It's perfectly normal. In fact, if you encounter a nasty virus, it's a very good immune system to have. But there are situations where it can get a little bit out of control and cause the problems that we've talked about. Now, the building blocks are inherited, but the important thing is that most people with an immune system like that won't get these diseases. And that's because the trigger from the outside, which irritates the immune system, is the key bit. And as long as your children don't encounter that particular trigger, which they're unlikely to, because these are chance events, then they're at no particular increased risk. For a female child, they would have a lifetime risk of about 1 in 700 to 1 in 1,000 of getting PBC. A son, 10 times less because PBC is commoner in women. So it is commoner than in the population itself, but the risk still remains very low. People often ask then about screening, whether it would be helpful to do that. And the answer to that is that we don't tend to recommend it. The reason is, obviously from what I've said, the risk of actually it being positive is low. But there is the additional factor that once you've been screened for a disease, there are some insurance implications that come with that. So we tend, for that reason, not to recommend it. Though clearly, if there is a particular concern, then it's helpful to do it. So if you have a particular concern, or your children have a particular concern, and it's actually causing them real worry, then the common sense advice is to do the screening. So what we advise to people with regard to risk of the disease in families is not to screen, but to be aware of the slightly increased risk. So should they develop any of the symptoms, the itch or the tiredness, or should they be found to have abnormal liver blood tests, think of PBC and do the tests at that point.
So what happens now? Where do we go from here?
Well, we'll do some more blood tests. That will be a regular part of what we do in the clinic to monitor progress of the disease, and once a year we will see you back in the clinic and do questionnaires to assess how you're managing symptomatically. We take a very structured approach to the disease. We'll start you on the URSO, and we'll also start you on the Questran to see if we can control the itch, and we'll give you another appointment for the clinic in a couple of months to come back and talk about how you've got on with the treatments. We often find that people have questions that they can't think of at the time and think afterwards. Just jot them down and bring them along and we can talk about them next time. Have you got any questions?
No, I don't think I have at the moment.
There's one last thing that I'll say, which I always save until the end of the consultation, which goes back to this issue of perceptions of the disease. We've used the term PBC all the way through, and I haven't used the full term, and there is a reason for that. PBC stands for Primary Biliary Cirrhosis. And that's an unfortunate term for 2 reasons. The first is it includes the word cirrhosis. And going back to one of the things we said at the beginning, there is an assumption that cirrhosis is associated with alcohol. Of course, PBC isn't. And the second reason it's unfortunate is that cirrhosis is a pathological term. It relates to the combination of the liver regenerating plus scarring, and it relates to the advanced form of the disease that only affects a small number of people. In the 1950s, when it was coined, that was the norm. but we suspect very strongly that you have early and mild liver disease, and so therefore you don't have cirrhosis. So the term is unfortunate. It includes the word cirrhosis where there's an assumption of the presence of alcohol, and it also implies a severity of disease which isn't there for you. We are, however, stuck with the term, and we tend to use the abbreviation PBC rather than the full term to avoid those misconceptions. If you haven't got any more questions, we'll do the blood tests and we'll just give you an appointment to see you back in 2 months' time. And I think that the final thing I say to everybody, most important thing is, don't worry about this. This is something which is manageable and controllable, and it is nowhere near the problem that sometimes people think it is.
Okay, thank you.
Of course, all consultations vary as all patients are different. However, patients often come away from a first consultation feeling a little overwhelmed.
When I was first told that I had PBC, it was a big shock, a very big shock.
And I remember certainly sitting up long into the night thinking, why me? And, what are we going to do about it? And where do we go from here? Because we had children were quite young then. So, it was scary. This wasn't something that I was expecting to hear.
The type of question I asked, I believe, was what was the cause of PBC and why? Liver disease, because I didn't drink.
There is a longer section of frequently asked questions and answers in the extra information section of this DVD. We heard a little about PBC earlier in the consultation with Professor Jones. Let's just go over the key points again. We'll start with a look at the liver and find out how it works. The liver is a complex organ which can be found on the right upper side of the abdomen, tucked up under the ribs. It has a very important role in controlling over 500 functions in the body, some of which we still don't fully understand. Its main role is removing poisons from the body, but it also manufactures sugar, protein and clotting factors and helps us to fight infection. The healthy liver has channels called bile ducts, which drain bile away from the liver. Bile is very important because it moves digestive juices away from the liver to the gut, as well as removing poisons from the liver. Primary biliary cirrhosis is a liver disease which causes damage to the bile ducts of the liver. In PBC, the body appears to treat the bile duct cells as though they are a threat to the body and tries to attack them. Over time, this process damages the bile ducts, leaving them inflamed and swollen, making it more difficult for the poisons to be drained away. This leads to progressive damage to the liver, causing scarring, which becomes widespread in the long term. This damage and scarring may lead to what is known as cirrhosis. It is very important to emphasise that this process usually happens over many, many years and may not happen at all in many patients. When first diagnosed with PBC, many people panic when they hear the word cirrhosis. In fact, primary biliary cirrhosis is a misleading name for this disease because many people never develop cirrhosis at all.
42 at the time, being told I had this disease, the only word I could hear was cirrhosis. And I kept saying to him, "You're saying to me I've got cirrhosis of the liver?" And he kept saying, "No, I'm not saying that. I'm saying you've got primary biliary cirrhosis." So it was a very unreal feeling, and it was just a case of I couldn't come to terms with this word cirrhosis. I knew what it meant, but I couldn't relate it to myself.
The vast majority of the public today even still think they put cirrhosis with alcohol, the two go together. It's very hard to separate them.
People often associate the term cirrhosis with drinking too much alcohol. This is not the case. The term cirrhosis simply refers to the combination of the scarring of the liver caused by persistent liver damage over time and the liver's attempts to fix itself. Sometimes, because of cirrhosis, there is an increase in pressure in the blood vessels around the liver. This is called portal hypertension and can lead to abnormal veins in the gut or accumulation of fluid called ascites. However, it's really important to emphasise that many people with PBC will never develop cirrhosis at all. PBC is a condition which seems to be more common in Northern Europe and North America. In the northeast of England, 1 in 700 women over the age of 40 have PBC. It affects 9 times as many women as men. The reason for this is not clear at the moment, but it is something future research hopes to explore. The cause of PBC is currently unknown, although there is much research being done to try to unravel the mystery. At the moment, it is thought to be an autoimmune problem, where the body's immune system doesn't work properly and turns on itself. To a limited extent, PBC does seem to run in families, with about 1 in 30 people with PBC having other family members who also have it. While people with PBC tend to present to their doctor with symptoms around the age of 60, it can occur in any age group. In fact, in our clinic, we have PBC patients in their 20s, 30s, 40s, through to their 80s. Some present with symptoms that turn out to be PBC. Others are not aware of any symptoms but may have blood tests for other reasons which show that the patient has PBC. Research has shown that people with PBC often have several abnormalities of their immune system. In the future, these studies may help to explain what causes PBC and why it occurs in some people but not in others. Some studies have suggested that PBC may be triggered by some sort of infection or toxin. In order to diagnose PBC, a number of tests are necessary. Firstly, liver function tests, or LFTs, are carried out. These test the blood for evidence of damage to the cells of the liver, but can't determine the cause of the damage. The next blood test to be carried out looks for specific antibodies in the blood, which suggests that PBC is present. One of the other causes of these abnormal blood tests can be gallstones or a physical obstruction, so it is important to rule this out. This can be done very easily with an ultrasound scan. This is the same sort of scan women have when they are pregnant and allows the doctor to take measurements of the liver and other organs.
Having a liver scan again, there's nothing at all to worry about. I think the most uncomfortable thing is the cold jelly which they rub on your abdomen before they put the ultrasound scan over your abdomen, and again, no discomfort.
Sometimes it is necessary to have a liver biopsy to confirm the diagnosis of PBC, although these days most people do not need this procedure. If you do, it will be because it can provide information that can make an important difference to your treatment.
You lie on your side on a bed, and the doctor gives you sort of a local anaesthetic, and a needle is inserted into the liver region, and a tiny amount of liver is withdrawn, and you don't feel it at all.
The worst part really is you've got to stay still in your bed for it ranges from 4 to 6 hours, and that can be uncomfortable, especially if you've got back problems, because you're lying in bed, you're in one position and they don't like you moving around, and that's in case you have a little bleed, although that very rarely happens. And after the biopsy, you're monitored all the time, your blood pressure's taken constantly, the nurses come and check how you are, so it's really quite straightforward. It's more a case of it's the fear in your own head. When they tell you they're going to do it, you're fine, and then when you see that they're going to start, you do tend to get a bit panicky. I always say it's a sweaty hand syndrome, but really it's over and done with very quickly, and then you're back to your bed and you're left to rest.
Once PBC has been diagnosed, the response to treatment will be monitored mainly by further blood tests. Only very occasionally might it be necessary to repeat the liver biopsy. When we see a patient with PBC in clinic, in addition to assessing any liver damage, we also need to identify any symptoms they have as a result of PBC. These symptoms vary enormously in both men and women. Often the severity of the symptoms bears no relationship to how severely the liver is damaged. These symptoms can have a considerable impact on people's quality of life. Symptoms that both men and women with PBC most frequently complain of include the following: fatigue and daytime sleepiness, itch, dry eyes and mouth, problems with sleep at night, problems with memory and concentration, and muscle and joint pains.
Fatigue for me is quite frustrating actually. You just feel very, very tired. You feel unable to cope the day that you are suffering fatigue. It does stop you quite a lot. And on the days that I do have severe fatigue, I just rest. And on my good days, I enjoy my good days.
I think it was the fatigue that really hit me right from the start. From the very start in 1986, I was always tired. I would take the children to school, I would come home, and frankly, I would lie on the settee most of the day. I would be there for 4 or 5 hours, and then I would pull myself together for the children coming home from school.
Until about 18 months ago, I don't think I had any what you would call significant symptoms. But certainly in the last 18 months, I've started to suffer from fatigue. I've become more prone to being just tired. The batteries have just run out of juice basically, and the things go flat. And I found it a little bit harder to put hours in at work.
Itch is dreadful. You're scratching quite a lot, and especially at night when you're hot, you do scratch a lot. But at the moment, my itch is controlled by a drug called rifampicin.
I don't really suffer from any itch. Although as soon as somebody comes along and says to you, well, one of the symptoms of PBC is that you can itch, then you instantly have itches everywhere.
I do have problems with dry eyes, especially if I've read for quite a long time. They become very gritty then, so you've got to stop reading. And sometimes dry mouth, which I can suck, suck the sweet, sugar-free if possible.
Muscle and joint pain can be very debilitating. What people don't realise is, if you get weak wrists, which we do, lifting a pan off the stove, if the pan's full of potatoes and water, it's a very difficult thing to do.
With my arms, when you're drying your hair, I have short hair, but I still have problems holding your hairdryer up to your hair, trying to dry your hair. You've just got to keep putting your arms down and wait until the pain, because it can be quite painful and they feel quite heavy, like lead, and put them down. Muscles in my legs, of course I live in a bungalow, but when I'm out and about and I have to encounter stairs and steps of any kind, that's when I get muscle fatigue in my legs, which the muscles go tighter and tighter the further up the steps you get, and that is quite painful.
Memory is a big problem with PBC people. We've all said for years that, we have terrible memories, and it's tended to be dismissed, but now the doctors realise we do have problems with our memory, and there's a lot more research going on with this.
Osteoporosis, known as thinning of the bones, is another condition which is common in patients with PBC and affects both men and women.
Osteoporosis, it's something you're told you have, you have, but it doesn't really affect you, you go with it, and of course you can be treated.
In clinic, patients have described a range of other symptoms, including difficulty in controlling their body temperature, thinning hair and weight gain. At the moment, there is no cure for PBC. However, many patients take a medication called ursodeoxycholic acid, or URSO. URSO is licensed for treatment of PBC and is thought to slow down the progression of the disease.
With something like URSO, you've got to think, well, all right, I don't feel any different taking it. I probably won't feel any different if I stop taking it. But the track record is, if you keep on with it, you may feel like you do now for longer.
Some people, after that go on to urso find they have a lot of bowel problems, they have diarrhoea. Now the doctors will say that, you know, you might have this for the first few weeks, but some people find it just goes on and on. But if you know it's going to be a problem, you know, there's ways around it. You take all your urso at night, so at least you probably like to go to the toilet a lot first thing in the morning, but as the day wears on, you'll be okay. But I think it's like everything. If you know there is a problem, you learn how to cope with it.
I take urso. I don't have many problems, occasional bowel problems, but I think urso is quite beneficial actually.
As well as trying to slow down the progression of the disease, management of the condition is very much centred on controlling the symptoms associated with it. Some of the symptoms can be treated quite effectively. Itch is a common problem for people with PBC and can be easily treated with a range of oral medications. It's important to mention this symptom to your doctor so they can decide on the most appropriate treatment. Dry eyes and mouth can also be helped relatively easily with lozenges and artificial tears. The fatigue that some PBC patients experience is often the symptom which affects them the most. At the moment, it's not clear what causes fatigue in PBC, and there are currently no cures for it. If you suffer from fatigue, it's important to rule out other causes, such as anemia and thyroid problems. Research shows that fatigue is worse in some people on certain medications and also in people who have difficulty in regulating their blood pressure. Again, it's worth mentioning the symptoms to your doctor, as there may be things that can be done to help. Osteoporosis is a common condition that appears to affect a large proportion of people with PBC, both men and women. It's important to check whether osteoporosis is present by measuring whether your bones are thin every 5 years. This is done by an X-ray scan called a DEXA. If this shows osteoporosis, then treatment can be given. There are a number of ways you can help yourself cope with the symptoms associated with PBC. Having PBC means the liver finds it more difficult to carry out certain functions, such as breaking down some medications. It is important to mention that you have PBC to your doctor and pharmacist when taking any medication, whether it is prescribed or something you can buy over the counter. It's also important to mention it to your dentist. It may be difficult to digest food and drink if you have PBC, so it is important to try to eat healthily and drink sensibly. Eat plenty of fruit, vegetables and carbohydrates and just a little fat. It may be helpful to eat little and often if you suffer from digestive problems such as heartburn. Alcohol is dealt with by the liver, so if it is damaged, it may struggle to cope with this task. This varies between individuals, so it is important to discuss with your doctor whether you can drink alcohol and how much. If you have cirrhosis of the liver, you may need to modify your diet. This may be necessary if you experience fluid retention, known as ascites, periods of feeling confused, something we call encephalopathy, or diarrhoea with stools which are difficult to flush away. Your doctor can advise you on this and, if necessary, refer you to a dietitian. Fatigue associated with PBC can affect people's ability to work, as well as the things they do at home and in their spare time. So patients may need to make adjustments in their lives.
From my point of view, as a teacher, I mean, yeah, I'm lucky I get loads and loads of holidays, I know. But the sort of 55, 60, 70 hour week in the last 18 months, 2 years has become problematic for me. So that means I've got to restructure my professional day. I can't get up and go to work at 7:30 in the morning, come in 5:30, and then have a meal and then do another 2 or 3 hours work. If I do that, it just won't happen. I'll just run out of energy. So it is a question of being able to have the working environment in which you can actually pace yourself.
You can still do everything you've done before, but you'll do it at a much slower pace, and it'll take you much longer. And if you can accept that, I think that's half the answer. That was half the answer for me anyway. Once I came to terms with that, I could cope with it.
I think you must learn to accept that you're going to have fatigue, and to pace your days, to pace your activities, and to try and plan your days when you are tired. If you are having a day when you're very tired, as I've said, try and rest those days, and on your good days, catch up and enjoy what you enjoy doing.
It is important to accept that it is okay to have a rest or a nap during the day, as this can help you keep going and cope better with fatigue. It can also be helpful to do some gentle exercise, but only when you feel able. Walking or gentle swimming can help you to feel fitter without being too exhausted. From time to time, having PBC may get you down. If this happens, it is important to have people around you who are understanding and supportive.
You've got to realise that the life you knew before has changed. It's not that you have a bad life with PBC, but you have an impaired quality of life, and you have to learn to come to terms with that. It's a bit like a bereavement. When you're first diagnosed, you've got to let yourself have a chance to come to terms with what you've got. You've got to accept you've got a disease that is going to be with you for the rest of your life, and it will affect you to a greater or lesser degree with each person. But in my case, it took me about 2 years to actually accept that I had this disease, and once I started accepting, although I was tired just the same, it was easier.
Talking through your feelings with a friend or a family member can help. It might be useful for those close to you to watch this DVD so they can understand a little more about PBC themselves. However, if you are having particular trouble with your mood, do mention it to your doctor. Some people with PBC may have difficulty with their memory and concentration. If you are affected by this, there are a number of things you can do to help yourself. Making notes can be very useful. Get into the habit of writing things down. Stick notes where you will see them, such as on the fridge or by the kettle. A diary is another way to help you remember things. Use it to write down appointments and things that have happened or been said. A wall calendar is another useful tool for this purpose. Depression and anxiety can also affect memory and concentration. Worrying that our memory is failing us can sometimes make the problem worse. If you feel depressed or anxious, or you're simply worried that your memory is getting worse, it is worth mentioning it to your doctor. Support groups offer lots of help to men and women of any age with PBC, so joining a group can be a really positive thing to do.
I think it's very important to have someone to talk to about PBC. When I was first diagnosed, there was no such structure, and for the first 7 years I used to wonder, was I the only person in clinic with PBC? Now, I knew I wasn't, but it always went through my mind. I used to think, am I brave enough to stand up in clinic and say, excuse me, has anybody else got PBC? But at the time, I didn't have the courage. Meeting other people with PBC, it normalised it for me. It made it, it wasn't just me. I wasn't isolated. I was one of a group. And I think for other people, when you get to talk to someone else with your disease, it takes away the isolation. It makes you realise, you're not a freak. You're having the same symptoms as other people. You're learning to deal with it in the same way as other people. And I think it just generally makes it so much more, you're an ordinary person.
At first, I thought, no, support group isn't for me. But then I decided to go along to a support group. And I must admit, once I joined the support group, I find it helped enormously. Socially, it's a good social outing. We have wonderful camaraderie amongst us. You can talk to people about your worries and concerns, and to like-minded people, because they understand what you're talking about. We have very, very good informative talks, and we're kept up to date with any research with the doctors. Professor Jones and Dr. Newton both come, and it's very good.
But some people don't feel that it's necessary, as they feel okay about having PBC and are getting on with life pretty much as normal.
My liver's not working. I'm not, I haven't got jaundice. I'm some significant way off cirrhosis of any description, which means the liver's actually scarred, which it isn't. So my liver's working fine. Yes, there are some abnormalities in the blood tests, and I have to go once a year. And the only change in my life really is the fact that I can't do everything that I would, in an ideal world, I would like to do. I can't run around, I can't do all the sport. I've got to be realistic about A, the fact that I'm not 25, I'm actually 54, and B, it will, if I do these things, it will take it out of me. So I've got to just be aware of the fact that I've just got to act like a 54-year-old.
My experience with PBC is it's come a long way. Yes, you have your frustrating days, you have your days when you're poorly, when you don't feel well, but there are days when you are quite able to go out and still enjoy life, and have every confidence in the research and the liver unit at the Freeman. You have every confidence in the doctors, because they do everything for you, and hopefully they'll find a cure one day.